Well, this morning we are talking health, and we've got Greenwood Leflore Hospital, and it's summertime. You know, you get out there, you've got pollen, all this other stuff. A lot of people dealing with things such as asthma. This morning we're joined by Mr. Campbell, who is a registered respiratory therapist. Good morning, Mr. Campbell.
Good morning.
Hey, we're talking about asthma this morning, something you are expert in. Tell us a little bit about the stages of asthma. Can you tell us what is it and maybe how people get it as well?
Well, asthma is a chronic inflammatory disorder caused by a variety of allergens. It could be dust mites, smoke, especially tobacco smoke, perfumes, pet dander. Cats seem to be the worst. The stages, you have persistent asthma, where you have symptoms continuously. You have nighttime symptoms frequently, and your peak flow usually runs about 50%. You have moderate asthma, where you have symptoms daily. Nighttime symptoms, you have 5 to 6 per month, and your peak flow is between 60 and 80. You have mild asthma, where you have symptoms 3 to 6 times a week and 3 to 4 times during the month, and your peak flow is usually around 80. And then you have mild intermittent asthma, where you have symptoms twice during the week and twice during the month at night, and your peak flow is usually 80 or above.
Now, when we talk about asthma, explain to us just a little bit, what is happening inside maybe somebody's airway that is causing them to have the trouble?
Whatever your allergic reaction you have, you start getting, airways start constricting. You can compare it to a water hose versus a straw. You start producing a lot of secretions. These secretions are usually thick and sticky and hard to remove, and then your airway gets inflamed due to the asthma.
And so when you have asthma or somebody has it, how do you as a doctor monitor that?
Well, one of the best tools is this little device right here. This is called a peak flow meter, and they make several different types, but they all work the same. And they broken down into zones. You have a green zone, a yellow zone, and a red zone. And just like your traffic light, green means go, yellow means caution, and red means stop. So what you need to do is figure out what your predicted normal is. So you would need to do this once in the morning and once in the evening, and use it before you use your asthma medicines. And you would graph those out, and most of these things come with a little graph that you can graft out on paper. And once you figure out what your normal range is, if you get up and you're moving less than your normal, say my normal is 400, that's my average. So I get up one morning and I'm moving 300, that's the best I can do. Then I'm in the yellow, which means caution. And according to how your doctor has you set up on an asthma plan, you may want to increase the amount of medicine you're taking.
Now, can you explain one thing to us? I've heard you say this multiple times this morning, peak flow. What is peak flow? It's
the maximum amount of air that you can blow out in one breath.
Okay.
And what you would want to do is you do this 3 times and take the best 1 out of 3, and that's the one that you would document. Now, if you say my average is 400, and when I'm blowing on this peak flow meter, the best I can do is 200 or less. I'm down to 50% or less. That means I'm getting in trouble. That means I either need to call my doctor or go to the emergency room. The peak flow meter is a really good early indicator when your airways are starting to close up on you.
And you may be having trouble. Let me ask this, finishing up this morning. If somebody does have asthma and they have these and they're able to measure, what are some recommendations? You know, Tawana was asked a question earlier. Is the heat affecting people, and what do they need to be doing?
The heat affects it. You just need to be, on an asthma plan and work it out with your doctor. You need to really know what you're allergic to, what triggers your asthma.
And just keep a pinpoint.
And keep your rescue inhaler with you. If some people have exercise-induced asthma, so it'd be a good idea to use your inhaler about 5 to 10 minutes before you actually get into exercise. You can lead a fairly normal life with asthma, but you have to keep it under control and learn to monitor it.
I like what you said a minute ago. Get with your doctor and have a plan. So, fantastic. Mr. Campbell, thanks so much for being here this morning and educating us. If you'd like more information, be sure to go to glh.org. That's greenwoodleflorehospital.org. You can also check our YouTube page and our Facebook page as we put those up. Thanks so much for being here this morning, Mr. Campbell.
Thank you.